Hello everyone, I am Dr. Apeksha Merja. I am MD dermatologist. I have been practicing at Enliven Skin MD clinic in Ahmedabad. Today we'll be discussing about hair loss, its remedies and role of oral supplementation. So naturally there are more than 1 lakh hair follicles on the scalp. Hair growth occurs in cyclical pattern. So there is a hair growth phase or anagen phase in which hair grows continuously. The rate of hair growth is around 1 centimeter per month. Now at any time 90 to 95% of hair are in growth phase, and the growth phase of scalp hair is around 2 to 6 years, but the growth phase of other body hair like eyebrows, eyelashes can be in the months. The anagen or hair growth phase is followed by catagen or involution phase, in which hair follicle regresses, and this is followed by telogen phase or resting phase. In this phase, all the hair activity ceases. The hair is in resting phase. At any point of time, around 10 to 15% of hair are in resting phase. This is followed by shedding. So at any particular day, if 25 to 100 hair follicles shed, it is considered normal. Once the hair sheds, it again goes in anagen phase and the hair cycle continues. Now why this is important to know? Because sometimes normal telogen hair shedding can also look like a lot of hair fall, but you have to get it checked from your dermatologist. Now hair fall can be a matter of impact on the psychology, impact on the confidence, impact on the self-esteem. So it is important to find out the cause of hair fall and to treat it accordingly. In Indian scenario, the most common cause of hair fall is nutritional deficiency. Most of the patients, particularly females which visit the clinic, have either iron, B12 or D3 deficiency. Apart from deficiencies, hair fall can occur 3 months after any major life event, like after accident, like after acute febrile illnesses, after chronic stress, after childbirth, after certain medications, sometime after crash dieting. So anything major happens after 3 months, there can be hair fall. This is called telogen effluvium. Other causes include hormonal imbalances like hypothyroidism, hyperthyroidism, PCOD. But in all these cases, active telogen hair or terminal thick hair falls and thick hair grows back. There is an entirely different condition which is called androgenic alopecia. In this, hair thinning or miniaturization can be seen. So the hair becomes thin. This occurs because of either genetics or because of hormones, or other causes are idiopathic. As per the pattern, it can be called male pattern baldness or female pattern baldness. So coming to role of nutrients, a healthy diet which provides right amount of nutrients always help in healthy hair growth. Diet which contains good level of iron like spinach, like nuts, like berries. So all this thing, non-vegetarian food like red meat, fish, eggs, this help in good amount of iron. There are food which are having great amount of protein. In vegetarian options, tofu, beans, the green peas, all the seeds. So all these products are good in protein. For non-vegetarian options, again chicken, fish, eggs are good source of protein. There are certain diet which are fortified with vitamin D3, vitamin B12. Again this helps. Vitamin C helps in good absorption of iron. So citrus food can be taken along with. So overall, green leafy vegetables like spinach, seasonal fruits, avocado, berries, all the nuts, almond, cashew nut, in non-vegetarian options, all the fishes and animal products. So all this food or all this diet which is balanced in nutrients always help in healthy growth of hair. On the other hand, if people go for crash dieting, like they are losing 7 to 10 kg in few months, this can lead to post weight loss telogen effluvium after 3 months. Apart from, there are people who are having a bit of nutritional deficiency which can be corrected with food only or diet only. But most of the people have proper nutritional deficiency which can be corrected only with oral supplementation. So when you visit your dermatologist clinic, there is chance that they ask you for few blood investigations, and accordingly they can prescribe you certain oral supplements. Most oral supplements in hair fall patient contains iron, vitamin B12, vitamin D3. Apart from them, biotin, essential amino acids, omega fatty acids, micronutrient like zinc, all these things help in good amount of hair growth. Apart from oral supplementation, there are certain topical medications available which help in hair fall. So topically, Capixil, Redensil, Anagain, Procapil, biotin, caffeine, all these products help. In androgenic alopecia, where there is hair miniaturization, vasodilator like minoxidil helps a lot. So which medication to start when, which topical will help, which oral supplementation can help, will be taken care of by your dermatologist. There are certain medical interventions which can help in hair regrowth. So there are GFC or growth factor concentrate, there are platelet rich plasma therapy, there are exosomes now available for hair growth, there is low level laser light therapy, and if nothing works, there is hair transplantation. So there are many treatment options for hair fall. Coming to, there are certain myths which patients have that combing your hair 100 times a day gives you shiny hair or good hair. So that is not at all correct. Like if you are going to comb it multiple times, there is more chance of hair breakage, so should be avoided. There are people who sometimes think that because of wearing hat or because of helmets they are having hair fall. This is again not true. Most of the times what happens is the age of androgenic alopecia and the age of driving is same, and people sometimes correlate it with wearing helmets. That is not true. Role of hard water. So hard water, usually what it does is it can lead to hair breakage. However, there is no hair fall from the roots. Stress does have effect in hair fall. When your body experiences stress, there is release of stress hormones or cortisol from your adrenals, which lead to hair loss. So lifestyle modification, yoga, meditation, relaxation, whatever helps you to reduce your stress can help in hair growth. Apart from that, certain hair combing practices like wearing very tight ponytail can lead to traction alopecia, should be avoided. Frequent use of heating devices like frequent straightening, frequent smoothing, or frequent use of straighteners in daily life can also lead to hair breakage, should be avoided. And if you have to go for it, then you have to use heat protectant spray prior to your procedure. It's mandatory to reduce the hair breakages. Coming to shampooing, there are people who believe that shampoo leads to hair fall and they frequently ask to change the shampoo. Now shampoo, if applied for twice a week for 2 minutes, it stays on your scalp. It cannot cause much of hair fall, but it is the hair which have been weakened 3 months back, they are falling. So shampoo, you can use your own, except if you have dandruff or seborrheic dermatitis. In that case, your doctor can prescribe you a particular shampoo. Coming to conditioners, again there are people who think that conditioners lead to hair fall. So when you wash your hair with shampoo, it leads to negative charges on the hair. If you do not use conditioner, there is chance that it leads to frizziness. So you have to use conditioner, but shampoo should be used on the scalp and conditioner should be used on the length of the hair. So in this way you can reduce the frizziness. You can also apply serum on damp hair to reduce the frizziness. Coming to other myths, like people think that hair oils are mandatory for hair growth. So it is the massage or champi that increases microcirculation and lead to hair growth. The role of oil, I think, is more of protective. It protects your hair from the sunlight, protects your hair from the pollution, from the chemicals of shampoo. But most of the oil does not help in hair growth. So my advice as dermatologist is, if you are feeling that your hair are falling more than normal, you have to visit your dermatologist to find out the cause of hair fall, to find out its type, to find out which medications to start. There are certain medicine like minoxidil. Once you start using it in androgenic alopecia, you have to continuously use it till lifetime or till you want your hair. That is the definition. But there are people who do not require it. So before starting any such medication, it is important to have proper counseling, to have properly your scalp checked with dermoscope to see whether you have androgenic alopecia or not. There are certain medicines which can be stopped within 3 months, within 6 months. Once your hair stops falling, we can stop those medications. So it is better to get yourself checked. Coming to shampoo, it is advisable to use shampoo at least twice weekly, at least 2 times in a week, to get rid of all the pollution, sebum, everything that accumulates on your scalp, leading to different diseases. But those who have to work outdoors, or those who have to work in construction business, or who have to go in pollution daily, can use daily shampoos, but they have to use very mild shampoo so that they do not get very much of hair fall because of it. Coming to home remedies, people think that all the home remedies usually work. When the cause of hair fall is nutritional deficiency or hormonal imbalance or thyroid, in those cases, if you're just going to apply egg mask or methi, so these things usually help in quality of hair. But until and unless your nutritional deficiencies are not covered, they are not going to treat your hair fall. So you can use those things for your quality, but not for the hair loss treatment. So this is everything about hair fall. Hope this discussion helped you in overcoming all your causes of hair fall. If any questions, do let us know. Thank you so much.
For more such videos, visit or log into dermavidya.com.